to be able to critically, objectively look at a patient's face and within seconds figure out what it is you want to do to this face to enhance this patient's beauty. We've taken your pictures. We're going to take a look at them now, and we're going to go through them and find out what things that you are interested in getting treated today and some other suggestions I might have for you. What areas of the face are of concern to you?
Here and around the lips.
Okay.
The crow's feet around the eye, and then the middle of the forehead. Yeah, and maybe some of the lines too along the forehead.
Okay. So for the frown line that you're mentioning here, that's a Botox area. So we're going to put Botox there, and that relaxes the muscle. And so in effect, the job of the muscle is to pull the brows together and down. So when you relax it, it lifts them up and pulls them apart, which gives you a nice open lift.
Does that do anything to your eyelids too? Does it lift those up?
Yes,
Yeah,
because
I like
they're
that.
attached. Yeah, I like that too, right? So yeah, when the brows go up, it takes the lid with it. So it takes some of that laxity that you have here. In addition, we're going to add Botox out here to the lateral portion of the eye, which will help with the crow's feet that you're concerned with, but that will also lift the lid.
But I won't look surprised.
No,
right?
no, not too much. It's all in the matter of how you do it and how much you put in. So as long as I know what your design aesthetic is to look natural, I'm going to tailor my treatment towards what you want to have happen. We'll also do a little bit on the forehead because you said those horizontal lines bother you a little bit. I don't like to do a whole lot because that is the muscle that keeps the brows up. So the least amount I can put in the forehead and get the best effect, the better brow lift you're going to get, which I think overall is going to add to your appearance of beauty, is just to get those brows up and get the heaviness off the eyelids, because you have such great eyes. They're the most beautiful, clear, crystal blue I've seen. And so you want to be able to see as much as you can of them. And right now they're kind of crowded in by some of that laxity going on around the eyes. So under your eyes is another area that it gives you a little bit of an aged look, a hollow, sort of that dark look under here. I don't know, do you use a lot of concealer under your eyes? Yeah. And some of that is to conceal the darkness, which is caused by a hollow, which happens when we age. We lose a little bit of that tissue under there, some of the fat, some of the bone is actually wasting away. And so to replace some of that volume, it really helps build that back up. So what we do is we go underneath the muscle and lift that muscle up to take the space. So we're not actually putting a whole bunch of filler in here so it looks voluminous. We're lifting that muscle up to take the space that's gone right here. So it's a very natural look, and it's not painful. It sounds horrible to have a needle up by your eye, but it's actually one of the least painful areas to do dermal filler, and that lasts a really long time. So that's a great bang for your buck. You had said you were concerned with some of the perioral or the wrinkles around your mouth, and I think that would be great. We're going to do some dermal filler around there. So I think if we can reshape this area with some dermal filler, that would look great. Coincidentally, your wrinkles will be a lot, smoother, mostly gone. We lose 1% of our collagen a year after the age of 30. So it hits everywhere. But what happens around the mouth is that even in earliest 30s, it starts to sort of target around the mouth, and that's when we see those early lipstick lines. Even in your 30s, you probably notice that. And it just continues to break down from there, and then it starts targeting the actual lip. Even though we're not going to do your lips and give you the fish duck lips or whatever, we will be re-establishing some of that shape that you had in your lips when you were younger, and just by redistributing and rolling out your own natural lips. We use a formula here called decade dosing. So if anyone comes in and they haven't had a lot of work done, we like to sort of give them an idea that after they've lost this volume, that they need at least 1 syringe per decade to regain that volume. So it's sort of a baseline of what you've lost and how we can replace it to bring you back about a decade ago. So you're looking at about 6 syringes because you're closer to the 60 range. Now, what we can do is do them all at once, which gives you the benefit of just having one downtime, and it's a social downtime. It's not like you can't go out. It's just that you might be a little bit bruised, a little bit red and swollen. Or we can stage it. We can do certain areas that bother you the most and then come back and clean up. What happens though is if we take care of the areas that bother you the most and those are now cleaned up, other areas are going to start to bother you more. And so I recommend trying to get it all done at once. I think it's the most economical because we end up doing multiple syringe discounts after we hit about 3 or 4. We end up discounting if we can do it all at once. But if your budget can't allow you to do that, we can definitely stage it and you can do 2 or 3 at a time. But I would try and get the entire project done within 6 months or so that you can get the best benefit. And you're going to get a good 18 months to 2 years longevity out of this. And even when you come back at 18 months to 2 years, you're not going to need 6 again. So if you have a particular budget that you're coming in with, it's important for me to know. And then I can start sort of showing you the things that we can do within your budget. And then I'll show you the things that we couldn't do outside of your budget. So after that $2,500, let's say, you know, there's 2 syringes here and this is where I would put them. And then you can make that decision. You can come back later, or you can decide at the moment that you decide, you know what, let's just do it. It's up to you. So we want to do as much as we can to accentuate your most positive attribute, which is your eyes. And by that we can put in the volume here in the temples, which is just an extension of this cheekbone. Right now, your cheekbone stops right here at the lateral aspect of the eye, and then it goes into a concave. And so by volumizing this area, it's going to extend this cheekbone all the way up and give you a nice uplifted look here. And we'll start with that, and then when we do that, it takes up some of the weight and the slack that's going on down here. So if I start here, I'm not going to need as much down here. But definitely we want to address this jowling that you have on the jawline, which is very typical. As we age, you know, that tends to break down the bony structure and leave some draping, and it ends up being right around the jawline and giving that wavy kind of jawline. So we can redirect that tissue into the mid-cheek where you've lost some volume here, where your fat pad is separated, and you can kind of feel that little line right here that goes from the eye all the way down through the cheek. That line is the separation of the cheek fat pad, or the malar fat pad. And when that separates, part of it falls forward and creates this nasolabial fold, and the other part just ends up being a separation line right here. So by bridging that gap across it, you end up getting a nice lift on this fold, as well as finishing off that cheekbone right up in here. So it's really a nice look, and it gives you that upper third of the face, gives you the volume right here. We really want to keep the triangular shape with the most of the volume up here in the upper part of the face, and then have it taper down into a nice V in the lower face. As we age, that tends to shift, and we end up getting more square on the jawline, and the triangle inverts actually. You've lost a little bit of this volume, and that's what's another thing that's holding up your brow is the bone, the periorbital bone that's around the eye, and that is starting to go. So if I can recreate some of that bone with some dermal filler here and here, you're going to get a nice light reflection off this bony prominence right here on the lateral aspect of your eye. All of this that we've discussed is going to be about 5 syringes, maybe 6. It takes 5 of those syringes to make up 1 teaspoon, so it's really not a whole lot. It seems like a lot, and you've probably seen people on TV that look full, and I don't want you to be concerned that you're going to look full. I don't even like to use the term filler because it's sort of a misnomer. It's not really filling. We're redirecting and restoring. With your Botox, doing the frown line in here and a little bit up in the forehead, definitely want to do the crow's feet. We also would like to do a little bit of a lift on the jawline, the microtox, and maybe the Nefertiti under here, which relaxes the muscle. This muscle is called the platysma, and the job of the muscle is to pull the face down. So in my opinion, it's okay to get rid of that. We can definitely release that muscle and let the rest of the muscles that pull up do their job properly. You're looking between 75 and 100 units of Botox, which is about $1,000. So that's your Botox, and that lasts about 3 to 4 months, and then that needs to be maintained and repeated every 3 to 4 months. The dermal fillers, you're looking at about $3,500 for the dermal fillers, and that will last you a couple of years.
Now, is it true that when you've had this done before, and then when you come back again, usually it'll last longer and longer?
Absolutely.
As you go and you need less and less?
Right. So with the dermal fillers, part of what we do is we're stimulating the collagen with a needle. And your own collagen that gets stimulated after a treatment lasts 3 to 5 years. So to go back to baseline, it's going to take you a really long time just because you've stimulated your own collagen in there.
As far as, you know, smile at your normal expression, is that going to change at all? Or?
No. We don't actually inject any of the muscles that you use to smile with the neuromodulators. You should have the same smile that you had before. I know that's a personal thing for people. Oftentimes patients will say, I don't want any expression in here. They don't want to have to frown. But I do want it up here. I do want to be able to raise my eyebrows, and of course we're always going to want to smile. We're never going to take that away. But then there's some patients that, you know, want to have some movement in here just so they can feel like they can be intense when they want to. And so that's a discussion we have, and you let me know what you're looking for. And sometimes the question comes up, is the product movable? And the dermal fillers that we put in, they're hyaluronic acid, they're naturally occurring in your body, and they are very malleable. Typically, we like it to be completed by the time you leave. We do all of our sort of molding and sculpting before you go. But occasionally, if you feel like an area is too full, or there's maybe a lump or bump, we can have you come back and we can do some pressure massage to sort of blend that out a little bit. We also have a really great product that is an enzyme that actually eats up the hyaluronic acid. It's like a little Pac-Man, and it just goes and finds the hyaluronic acid. If for some reason you don't like the outcome, or it's too much, which I don't think it will be because of the quantity and what you need. But if for some reason, it's just nice to know that there's that remedy in your back pocket if you need it. So that's helpful, is that it is reversible. As women, we're sort of familiar with maintenance things. We get our hair dyed and we get our nails done. Those types of things are recurring expenses. So it's a little bit easier for us as women to swallow the fact that Botox needs to be done every 3 to 4 months. But just like everything in life, there is a little bit of a maintenance and an upkeep with beauty. The good news is if you can keep on task and get it every 3 to 4 months, you're doing a lot of retraining for your body. Over time, you can stretch that now about 6 to 8 months. And some of my patients only come back once a year for Botox because they've been getting it so long. One thing we need to address is your skincare. So what we have our patients start on their medical skincare, and then when they get to a point of plateau, which I'm assuming you are since you've been on it for a while, we want to kick it up a notch with a product called the dermal roller. So what this does is like an aerator for your lawn, or a meat tenderizer. It doesn't bleed or cause any holes or anything like that. It gives micro punctures, so it basically helps the products to penetrate the skin. So we have this sort of the shell on top of our skin. When we put our products in, you can absorb some of them, but only about 10%. And so you're kind of wasting like a lot of those expensive products. When you use this, you're absorbing about 80%. And I recommend that if you're going to spend the money on medical skincare, you might as well throw in one of these, which isn't expensive, and they last about 9 months to a year, to help those products actually work better and penetrate better. One of the things we can do later, if you still want some texture changes, and we noticed from your pictures that you did have some textural problems, we can use one of these that has a little bit longer needles, and we roll it over your face pretty aggressively in the office, and that actually stimulates your collagen. It creates a micro injury. Your body responds to that injury, sending collagen, elastin, and fibrogen, those are all great things. We want as much of those things as possible. And so sometimes we lack in our production of those, and you need some sort of stimulant to produce those 3 things. You can see it's not uncomfortable. You just do this for 1 or 2 minutes, a couple nights a week before you put your active products on, and that really gives you a benefit of absorbing more of those products. Another product I'm definitely going to recommend for you, because based on your skin scan, you had a lot of facial flushing, which was the redness, and vitamin C helps with that. It's an anti-inflammatory, so it helps actually cut that red a lot, and you should be on it anyway, just as an anti-aging preventative for sun damage. But it really helps for those of us, and I'm one of them included, that get a little bit ruddy and kind of flushed. Okay, well, if you don't have any other questions, we're going to go ahead and get started. I think you've been numbing. We're going to start with the areas that concern you the most, and we'll move on to those other areas if you feel like you want to add those extra syringes. And I'll give you a price as we go along. Okay, if we do your temples, it's going to be an extra, $500, or, and I'll kind of price it out that way so that you can make that decision at the time. All right, so that'll be helpful because you'll be on board, and it's more of a team effort that way anyway. And you get to see it going along. You'll get to see how it looks as we progress and as we go.
It's extremely important to take that time and, really give your all, even though you might not get a treatment out of it that day or ever. You really need to do that in order to build your practice and to build the type of clientele that you're going to hang on to for a long time. Hi, Jeannie, how are you?
I'm great. How are you today?
I'm very well, thank you. What brought you into the office today?
This area around my eyes right here, and I think that you can see the lines that are right here, and I would like to have a little bit on my lips, and I'd like to hear your opinion from looking at me, what you think.
I think that's great for a start. You have lovely eyes, so that's great that we can work around that for you. What I'd like to do for you is go through a certain range of scenarios, and I don't want you to feel overwhelmed by it because it might seem a little bit much if you're not used to this type of treatments. But I'll tell you what's possible, and then we can kind of pick and choose how we're going to do that and how we're going to play that out over time maybe for you.
Okay, I'm interested in your suggestions.
Okay. So I have some pictures here that we had taken of you, and I'm going to use them to go through this different options with you.
Okay.
Okay. I'm 100% certain we can achieve a great result for you with Botox and filler. Usually for someone your age who haven't had a lot done, we'd probably have to look at 6 syringes because you're 60 years old. And usually to get you back about a decade, we need to use a syringe for every decade of your age. So that's what we need to look at and kind of plan for and budget for in order to get a really great result for you. Okay.
So what kind of cost are you talking about?
So we're looking at about $500 for a syringe on average. So we're thinking about $3,000. And I know that that's a daunting thought, but you need to think of this as an investment, getting a great result with your initial treatment and then having something that has some longevity. So if you manage to make that investment initially, you have a treatment that's going to last you 18 months or longer. And when you get to the point where you need to touch up your treatment, it's only going to be 1 or 2 syringes, maybe every year or 18 months to maintain that result. The only way you get to that, though, is when you spend that initial money, and plan for your initial treatment and do it properly.
And is it all done in one day or over time?
You can do this 2 different ways. You can very easily do all of it in one day, and then you'll get the most dramatic effect from it as well, right? Mm-hmm. We want it to be noticeable, but we want it to be noticeable in a way that it's noticed as you looking the best you possibly can for your age. Natural, age-appropriate look. But aesthetics done well looks natural and beautiful for your age. You should never look done. If you want to plan for it and budget, that's also possible, but I would suggest that you do it in, a 6 to 9 month maximum time period, because otherwise you lose the effect of having that treatment. We can help make this more affordable for you. So, the last thing that I want you to do is spend a little bit of money and feel like you got nothing for it. Rather, we'd help you to plan for it, stage your treatments, do 2 or 3 syringes at a time, and make it so that you can afford to get a good treatment. I know this is a huge amount of money to think of spending on a cosmetic treatment.
I'm sitting here thinking beauty is expensive.
It is expensive, but if you think about the amount of money we spend on, things that we don't even think about every single day, and even clothing, that you wear for one season. Your face is something that you carry with you every single day. It's something that's with you wherever you go.
And especially mine, I'm up in front of people all the time, so I am conscious of that.
Even more so important for you, And it's part of what makes you feel confident in what you do, especially if you have to stand up in front of people, and that might sound superficial, but it's a fact of life, So if you can manage to get yourself over that initial investment, and just wrap your mind around that, it'll definitely be worth your while in future, because it won't be the same huge expense every time, but there will be some expense initially for you to get a good result. And it's no sense, spending a little bit and getting a result that you're not really happy with and you feel you don't really know where your money went. It's better to plan for it, make a good initial investment, and have a great result that will carry you for quite a few years.
Facial artistry brings a new element into the conversation when you are talking to your patients. allows an intimacy in that relationship. You know, you want to create a bond with your patient. You want to create trust. You always want to show the patient you have their best interest in mind. And that's what facial artistry does, because you are addressing their features, their best aspect, and then you're distracting from their least favorite aspect. They're maybe their most unattractive. So what brings you into practice?
So I'm getting close to 40, and I just thought I should look into this just to see about, you know, there's times I look in the mirror and I'm like, I see some wrinkles there, or I've got 2 young kids at home, and so sometimes I feel like I have that like angry wrinkle face in between. But I'll be honest with you, I'm terrified of needles.
So when it comes to being afraid of needles, the worst thing I can tell you about all of this is it is terribly addicting. So once you do a treatment, be it the neurotoxins, which are Botox, Dysport, and Xeomin, or the fillers, the dermal fillers, which the most common ones are Restylane and Juvederm. There's also Radiesse and a few others. Once you see the magic that these products can do, you kind of fall in love with the new you. And, you know, that fear of needles gets less and less and less. And just so you know, I really try to do everything I can to make this a comfortable procedure for you. I want you to love your treatment, and part of that is loving the actual treatment, that you want to sit here and knowing what's about to happen, because you're going to love the result. What I'd like for you to do is to show me the particular concerns. And now, these are mug shots. These aren't glamour shots, and so it's there for a purpose. These aren't pretty pictures. They're you, and they're you at your raw sense, and so we want to really kind of focus in on you and what bothers you, and then we can discuss what I can and can't do and what's realistic to help you feel better about yourself every day. And then what you'll notice is also not only where these little furrows start to relax, but this middle part of your brow will actually start to lift up a little bit, which will kind of open your eyes and give you a little bit more of a rested, perky look. So regardless of the kids keeping you up all night, you will at least wake up and look at yourself in the morning and go, wow, I look so refreshed. So something we might want to do is actually do a little bit of Botox here around your eyes to kind of pick up this lateral aspect of your eyebrow and just kind of open your eye up ever so more, so that people, when they see you, because you've got just really pretty green eyes, it just kind of opens and lifts this part up and lifts this up and just kind of frames your eyes beautifully. So when you were younger, this region of your face had a little bit more convexity to it. So if you go back 10, 15 years and look at this part of your face, it kind of rolls out like this, which helps to frame everything. And as we get older, it starts to become more concave. And it's a very subconscious cue to the whole aging process. It's an area that a lot of people don't realize is happening. But what happens is we can go in and we can actually put some filler in here and bring your temple back out and make it more convex. What that does is, that blood vessel that bothers you, it hides it. So that blood vessel all of a sudden has some padding around it, so it gets lost and you won't see it as much. It will actually take a couple of years off of your expression and your appearances, because, you know, if you rounded this out, you'd have this beautiful line from the top of your forehead that's what we call a temporal fusion line down to the top of your cheek. And it's just beautiful rounding. It's very youthful. And it's very relaxed and easy looking on everybody. And it's quite lovely. So that's something to consider. But what I do notice that's kind of contributing to this is you're starting to get a little bit of hollowness right here in the top of your cheek. And what we refer to as the tear trough in the upper cheek is starting to flatten. And that's a natural part of aging. And something that you might not be aware of is that osteoporosis is actually starting to set in very micro amounts. So once we hit about 35, we start experiencing bone loss on very small levels. And when that happens, our muscles and our fat pads start to kind of rearrange themselves, and they start to move downward, thank you, gravity, and they start collecting here in that volume that you have here. You know, this little bitty pouch that might bother you a little bit is your fat pad that used to sit closer to your eye. So sometimes what we can do is, with the dermal fillers, is go in and create a little bit of volume here, and it's almost like you've lifted this back up. This by proxy will soften, But what we've done is, because we've created volume here under your eye now is completely framed. We've already done Botox here, so we've opened up your eyebrow and kind of helped with a little bit of the laxity that you're starting to experience. But now we've gone in and we've done a little bit of filler down here. So you've got this beautiful platform that rolls from your lid down onto your cheek, and it's just very youthful. And the best way to kind of describe it is, when you get a chance, go home and, we all have smartphones nowadays, and take a picture of yourself, and then go back and look at a picture of yourself in your 20s. And try to find a picture of your 20s and take that new picture in the same positioning, and just look at your cheeks right in through here, because you have beautiful cheeks. I mean, your cheekbones are just phenomenal, and I have a lot of patients who pay a lot of money to have those, and you've got them already. But what we can do is to soften this, is to go in and actually correct this, and we just, it's smoke and mirrors in a sense.
Yeah.
This is just a symptom of this happening. So I would encourage you to consider treating this area before we actually put any filler here. And these syringes are pre-filled, and they're very small amounts in each syringe. So it takes them on average 5 syringes to equal 1 teaspoon.
Wow.
And to kind of give you an idea, if you cook, if you took a teaspoon of chocolate pudding and put it on your cutting board and then tried to cut that into 5 equal portions, it's next to impossible.
Yeah.
And truly, that little portion is what's in a syringe. So
Okay.
small amount, but it does miraculous things. We want to stay where it looks you
Yeah.
and natural, and you just look spunky, and your girlfriends are thinking maybe you got highlights or you had your eyebrows waxed or
Right.
something. They know you look better, but they're just not sure how.
Okay.
As of right now, we're looking at 2 areas of Botox, which is about $400. And then we're looking, if we did everything that we talked about with filler, then we're looking at about 4 syringes of filler. So, and some of that we can do in stages. So like if you wanted to try on the look of Botox first, that's a great beginning, and it's an easy way to get your toes wet and see if you like it. But I can tell you, I haven't yet met anybody who had Botox done well that didn't want to do it again. Together, phenomenal results. They worked very, very well together. Just like you wouldn't have Oreos without milk. Sometimes you really don't want to do, Botox without your fillers with them.
Now, do you do like payments? Is there like, if I get all of that, is there like package that you have? Would I get it all done in one day, or do I need to like break it up over
It depends
time?
on your schedule.
Okay.
So if anytime we do injectables, especially the fillers, there's always the potential risk for bruising. And I like to tell everybody, realistically, you're going to get a bruise.
Okay.
So if you plan for it, then the likelihood, if you get a bruise, then you're not going to be quite so disappointed because you knew it was coming. So
Yeah.
I ask everybody to give yourself a 2-week window before any kind of a critical event. If
Okay.
you've got your best friend's wedding or a big event with your children, if it's within 2 weeks, then let's wait till after.
Okay.
We don't accept payment plans, but sometimes we also have specials. So if now's not a time where you can afford it, then definitely we need to get you on our email list so that you start getting email from our office. We send out a monthly special. And every couple of months, we'll do a special with one of the fillers. And oftentimes it's if you buy 2 syringes, you'll get a 3rd one for free, which is a
Okay.
huge savings of
Yeah.
at least $500.
Okay.
So there's that benefit. Our neurotoxins, we never put on sale. That's the set price. So that's something that you can just plan for. But filler, sometimes we do put it on a special. It wouldn't be uncommon for us to bust it out on a couple of different credit cards and even pay personal checks. Most women need to do some financial finagling so that they keep it under the radar of their husbands.
Okay.
So we are more than happy to work with you on that aspect, but we do expect full payment at the
Okay.
time of service. So let me ask you this, because we haven't brought it in. What is your budget?
Well, I don't necessarily have like a set budget, but now that I'm educated on how much it is, which to be honest, I think in my mind I thought it would be a whole lot more. But so it's at least something that it's not too overwhelming right now. Not to say that I can do it like right away, but it's something that seems a little bit more reasonable. So,
Okay. Did you want to start any of it today while you're here?
yeah, I think I would. Would we be doing all of it, or is there just an area that we could start with today to see how I respond?
Well, let me ask you this. With your kids that you have, do you have anything coming up that's pressing, that's important?
I do. Ava's graduating from preschool next week, so we'll have family pictures, and it'll be kind of a big day. So.
Okay. Well, why don't we consider this? Let's do Botox today and get you started on that, because by the time next week rolls around,
Yeah.
your Botox will be kicking in. So realistically, for your pictures, you'll be less frowny and your eyes will be a little bit more open,
Okay.
and you'll have a little bit more relaxed, perky look to you. And then we'll schedule you to come back in 2 weeks for your follow-up on your Botox, and we can do your filler at that time. And that way, you're not making a bunch of different trips. I want you back anyway. I want to see how your Botox does. If I need
Okay.
to finesse out your Botox and make it perfect, I can do it at that time, and then we can do your filler, and everything's taken care of.
That's awesome. Thank you
All
so
right.
much. Thank you.
Well then, perfect. So let me go grab some consents for you to sign,
Okay.
and we'll get started.